Dr. Richard Randle. I am the Beef Extension Veterinarian at the University of Nebraska-Lincoln. Today I'm going to be visiting with you a little bit about prevention and care for pink eye in cattle. If we talk about pink eye, it's known as infectious bovine keratoconjunctivitis, or IBK, commonly known as pink eye, and it affects cattle worldwide. Estimated losses from the effects of pink eye in cattle is $150 to $300 million per year. Most of those losses stem from reduced growth rates in calves, reduced milk production in cows, costs associated with treatment, reduced value of the animal, and in rare occasions, death loss. Pink eye is caused by a bacteria called Moraxella bovis. The way that bacteria works, it attaches to the cornea of the eye through pillae and begin to secrete enzymes which digest the surface of the cornea, leading to ulceration of the cornea. In your picture, you can see is a photomicrograph of the bacterium that are attached to a cornea, and you can begin to see the damage and the deficits that are occurring in the cornea as a result of that infection. There's a number of contributing factors that lead to the outbreaks of pink eye and how severe those outbreaks can be. There are a number of different strains of the Moraxella organism. Some can be more virulent or cause more severe disease than others. In addition to that, things like ultraviolet light or sunlight can irritate the eye and lead to the animal being more susceptible, as well as environmental irritants such as wind and dust and seed pollens and those types of things. Biological vectors play an important part in the spread of pink eye, such as flies. Animals that are suffering from concurrent disease or marginal nutrition are felt to be more susceptible for the effects of pink eye. When we look at how it transmits from one animal to the other, the organism itself actually resides in the nasal and ocular secretions of cattle, so cattle can serve as asymptomatic carriers and shed that organism and make it available for spread to other animals. Spread typically occurs from one animal to another through direct contact, through aerosols, meaning that a cow that is infected with this organism sneezes or coughs another animal, and it can also be spread by these vectors like flies, contaminated equipment, and those types of things. If we just take a minute to look at the normal eye, there's several structures there involved in cases of pink eye. What you see in the photograph there are the different parts. The nictitating membranes, our third eyelid flap, lies in the central medial part of the eye. The white part of the eye is known as sclera, and it is covered by a thin membrane called the conjunctiva. The cornea is the clear portion of the eye that we see. In cases of pink eye, we see it course through the diseases begins to cause inflammation in that eye. Some of the earliest signs that we see is the serous lacrimation or epiphora, which is nothing more than tearing. So the eyes water up as the inflammation spreads in the eye. As it progresses, those cattle become sensitive to ultraviolet light and exhibit photophobia or squinting, result from the pain when they are in direct sunlight. So often early signs that we look for are these wet, dirty faces in these cattle where the tears run down the face and collects dirt, as well as them squinting and closing eyes when they are infected with pink eye. As it progresses, inflammation begins to set up, and that thin covering the white of the eye, called the conjunctiva, becomes inflamed, and we have what we call conjunctivitis. We see them obviously it becomes reddened and edematous and swollen as the inflammation progresses during the course of the disease. Ultimately, as the damage to the cornea occurs, it causes a condition we call keratitis, which again, that cornea becomes inflamed and edematous, and you can see that we end up with a clouding of that cornea, a white opacity, and often then as it progresses, we see the development of the small defects in the cornea, such as a corneal ulceration. As it progresses, eventually we start the healing process. The way that actually occurs is the blood vessels from that conjunctiva at the edge of the eye infiltrate into the cornea to allow passage of cells to move in and fight that infection, begin cleaning up the destruction and the debris caused from that disease. Eventually, as the course of the disease ends, depending on the severity and how much involvement there is some scarring of the corneal tissue that can be fairly small and indiscreet, or it can be severe enough that that cornea can remain pretty opaque and loss of sight occurs. Most often, once the disease has run its course, eyesight is returned to the vast majority of these animals, at least in portion or to some degree. The course of this disease basically runs from beginning to end, anywhere from a few days to actually a couple of weeks to get all the way to the point of healing with the scar formation. And during that period of time, the pain and irritation associated with this often leads to those animals having decreased feed intake and difficulties associated with ambulating, especially if both eyes happen to be infected at the same time. When we look to diagnose cases of pink eye, the first thing we think about is a typical seasonal occurrence that we see with typical findings of these inflamed eyes. Although outbreaks of pink eye can occur anytime during the year, more common to see them in the warmer months when we have biological vectors like flies and those types of things that we see can commonly lead to transmission of pink eye. To confirm that it is a case of pink eye, we'd need a positive diagnosis based on a culture of that M. bovis organism. However, that organism can be difficult to transport to the lab, and once it gets to the lab, can be difficult to culture. So often, if we're suspecting that we have a problem, there's need to collect swabs from several animals for culture purposes, recognizing that there's a portion of them that we get negative results back or mixed results. One of the problems that we have in diagnosing pink eye is it leads us to what we call a diagnostic dilemma. Often, when we culture these eyes, we can find many other organisms in that eye, along with or without the Moraxella bovis organism. There have been rickettsia, mycoplasma species, various viruses, chlamydia, a number of other organisms that have commonly been isolated out of these affected eyes. And the difficult situation is to say which of these are an incidental finding that are just simply contamination, which of these are actually secondary bacterial or viral invaders that occurs following infection with Moraxella bovis that often leads to a more severe case of pink eye. However, the research has shown us that in trying to create pink eye with any of these organisms by themselves, it's very difficult to do. So it is felt that in cases of infectious pink eye, it really needs to have the Moraxella bovis organism present. There have been a variety of treatments utilized in cases of pink eye through the years. Some of the earlier treatments included topical application of ophthalmic ointments or powders that were placed in the eye. These topical antibiotics often needed to be applied several times a day for several days to have any effect, and that often proves typically impractical to do. A much more common thing that has been done over the years is to use subconjunctival injections. And what's done here is that we use antibiotics and or steroids or other compounds and actually inject that underneath the conjunctiva, that thin membrane covering the white of the eye. And once we do that, then the antibiotic slowly leaks back out of the injection site to bathe the ocular surface, and that's how treatment occurs. Typically, when we use these types of injections, it'll bathe that eye for about 8 hours. So in theory, these types of treatments actually need to be done more than once a day and more than once for several days to get an effect. Studies have shown that single subconjunctival injections have really not proven to alter the course of the disease in case of IBK. There is some work out there that indicates the use of systemic injections, specifically intramuscular injections of octreotetracycline, can effectively treat acute cases of pink eye. By injecting octreotetracycline intramuscularly, we can get a therapeutic level up to 3 days or 72 hours. And work has shown that in cases of acute pink eye, the injection of oxytetracycline can reduce the rate of shedding in those animals. People that have followed this treatment typically recommend 2 injections that are given 48 to 72 hours apart. And some data out there shows that if done this way, we may eliminate that carrier state of the M. bovis organism in those animals. There's also supportive treatment that needs to be considered in the case of pink eye, and often this may be as important as the antibiotic regimen used. It's important to think about ways to protect that eye from ultraviolet light. Again, these animals are very sensitive to that light, and it makes them very painful. So anything we can do to reduce that will give them some pain relief and become important. There are eye patches out there that are available that can be glued over the eye, or often you can make use of that third eyelid and slide it across the eye and suture it to the eyelid so that it gives coverage of that eye and helps protect that eye during the course of the disease. One means of potentially relieving pain is to inject subconjunctivally atropine, which causes the ciliary body, which is spasming during that time period, to relax and relieve a lot of that pain. It's important to remember that if atropine were to be used, that eyelid needs to be covered because the eye becomes fully dilated and will cause a real problem if it's not protected from the sunlight. Additionally, to reduce some of the scarring toward the end of the disease, often some type of a steroid preparation is placed in that eye as well. So a combination of antibiotic therapy and supportive therapy is the typical way in which we look to try to treat these acute cases of infectious pink eye. If we talk about control, then there's a number of things to consider, although each one of these of and by themselves don't appear to give us as full a control as we'd like, and it creates some frustration in this disease often that we don't gain the control we necessarily think we should, but there's several reasons for that. The typical areas that we need to look at is what can we do in our management practices that would reduce the effects of contributing factors that lead to higher susceptibility of these animals. The possibility of elimination of carry animals in certain situations can be considered. Often vitamin A is implicated as in situations where that's marginal in these animals may make them more susceptible. And of course, vaccinations are out there and available for immunization against pink eye. One of the big control factors that is difficult to do but plays a major part in this disease is phase fly control. We recognize that phase flies are non-biting flies, and they only spend time on the cattle when they're feeding, and they feed on the ocular and nasal secretions of these animals, and then they will leave for a period of time. So they become difficult to control from the fact that we have difficulty having enough contact time with our insecticides to effectively reduce those populations. The pyrethroid type insecticides that are out there don't show resistance in phase flies and have some minor repelling effect, but the real problem is typically insufficient contact time to kill very many of these flies. The organophosphate type have little no repelling effect and really have very insufficient contact to control that. Some of the newer insecticides that are coming on the market today may show promise, but it's just too early to determine how effective they will be in controlling phase flies and potentially controlling the effects of pink eye in these cattle. When we talk about the eye irritants, so dust, wind, weeds, pollen, sunlight, all of those things, again, are contributing factors. So any strategy that you can think of that helps reduce the effects of these irritants can aid in the control. So as an example, if we know we're gathering cattle into a tight confined area and it's dry and dusty, watering that down, wetting it down so we can reduce the dust can be advantageous. Clipping of pastures to take seed heads off that can cause irritation can aid in the control of that. In cattle that are eating hay, where we have out large round bales, one of the problems can be that cattle eat into the underside of it, so you have a shelf over the top, and as they stick their heads up in to eat, then you get contaminants falling into the eye from there. So difficult to control, but anything possible can have a positive effect in trying to reduce the problems associated with pink eye. When we talk about reduced direct transmission, opportunities to reduce overcrowding either in housing or feeding situations can help prevent that direct contact between animals and help to some degree. In the case where you have an animal that shows an acute case of pink eye, should consider segregating those animals from the rest of the herd to help try and break that cycle of transmission between animals. And it's important to remember that when we're treating an animal with pink eye, we should make sure that any instruments and hands and equipment and gloves and those types of things are cleaned between animals, or we can actually serve as the means for spread ourselves when we are handling these animals. Again, research has shown that the effects of octatetracycline can potentially eliminate carrier animals. The work that was shown required intramuscular injections of octatetracycline given twice, 48 to 72 hours apart. And in certain cases, in some herds, where they've had tremendous problems with that, they've actually gone into the cow herd and injected tetracycline shortly before calving to reduce those animals shedding and reduce the shedding between animals during the time of typical pink eye outbreaks that are expected to occur. Again, easy to talk about this, may be very difficult to implement, but consideration should be given, especially in cases where there's been severe problems associated with widespread pink eye in cow herds. There are several things to consider about vaccination for pink eye. Most of the reports give mixed results into the success of using pink eye vaccines. And there's several reasons for that. One thing that we need to consider is that just because we're calling it pink eye, it may not be the true infectious pink eye caused by Moraxella bovis. There is an eye form or ocular form of the IBR virus that can cause the eye to look very similar to pink eye, and yet obviously would not respond to pink eye vaccines. Most of the pink eye vaccines are directed against the pili that are associated with the antibiotic to prevent attachment to the cornea and against the enzymes that are produced by those organisms that cause damage to the cornea. What we can say consistently is if we make use of pink eye vaccines, we can expect that we would reduce the incidence of the number of cases in an outbreak, as well as those that do show pink eye. The severity of that disease and the course of that disease is lessened, so it's shorter, less severe. But we definitely need to keep in mind that vaccinating for infectious bovine keratoconjunctivitis does not ensure that we would not have any cases in a given situation. Part of that reason is that we recognize colostral immunity to Moraxella bovis tends to be long-lasting and can still be found evident out 6 months after calving. So vaccinating calves at a very young age may lead to some maternal interference from the colostrum and reduce the effectiveness of the pink eye vaccine. We also recognize that once an animal is vaccinated with the vaccine, that immunity is slow to develop. In other words, once we vaccinate that animal, we can expect 21 to 42 days to see an appreciable immunity develop in that animal. So vaccinating in the face of an outbreak of pink eye often may not alter the course of that outbreak. There's also poor cross protection against the different strains. So if the particular strain of the organism in your outbreak of pink eye does not coincide with what strain is in the vaccine, then we get very poor cross protection, and we see that apparently the vaccine didn't do us much good. We can also have some pretty hot strains of the organism that can overwhelm the immune response in that animal and still have outbreaks. And in addition to that, as we mentioned earlier, often these infections have multiple bacteria or viruses associated in that eye, and so some of these secondary invaders can continue to cause irritation and lead to what we would see as an apparent vaccine failure. In addition, again, as we mentioned, marginal nutrition or concurrent disease can reduce that animal's ability to respond appropriately to that vaccine and still leave them somewhat susceptible to the disease. In worst case scenarios, autogenous vaccines have been implemented and used on farms where we don't get any relief from other measures. And in those situations, basically what's happening is the organism from that specific farm is cultured, and from that organism a vaccine is manufactured specifically for that farm. That vaccine is site-specific and can only be used on that site. And often this becomes kind of a measure of last resort when everything else that has been tried has not given satisfactory results. And again, even with the autogenous vaccines made, our expectations are we see improvement, but not necessarily totally elimination of the cases of pink eye in that given herd. This can be a very frustrating disease to deal with, and the level and incidence of pink eye in a given herd can change dramatically from year to year, being almost none to very significant, back to none, and so it's not consistent year for year. Um, and as well, I've even been on some farms where you have one pasture where you have a severe problem with it and a neighboring pasture, no problems with it. So there's just a number of factors that go into the determination of how severe an outbreak you would have if you have one at all. Makes it very difficult to deal with and control. The best information that I can probably give you is that you should contact your veterinarian and be talking about a plan of action of how you deal with pink eye if you have that problem, and work through an appropriate process and plan for determining how to best try to counteract the effects of pink eye. You can also locate additional information at the University of Nebraska's beef website, which is at beef.unl.edu. Um, that concludes my comments for today. Hopefully you've gained some useful information out of that, and if there's any additional help or aid that I can be willing to give you, feel free to contact me at the University of Nebraska at any point in time. Thank you.